We are Kelsey Boss, Samuel Hasty, and Lachelle Haynes, and we are presenting on Autism Spectrum Disorder, also known as ASD. We chose this topic for various reasons. I chose this topic because it is a population that I feel is underserved. I feel that this population has a stigma, much like other disabilities. I have had experience with people of this population, but I've never studied autism. My main goal in studying autism is to have a better understanding of how it affects the individual.
I'm Samuel Hasty, and I chose this topic because I have never studied autism. I want to learn more about it because autism is much more prevalent than I realized. And going into counseling field, it is important to better understand how people with autism function in order to best help them.
And I am Kelsey Boss, and I chose this topic because I wanted to learn more about people with varying abilities. I personally have not had much exposure to folks with disabilities until recently. I now live in an apartment building with a few women who actually live on my floor who have varying abilities, and I think this knowledge about autism will help me gain more understanding about their lives. So we chose this quote by Dr. Seuss, "Why fit in when you were born to stand out?" Because people with autism are just like us. And we wanted to point that out, that just because you have varying abilities doesn't mean you're that much different than someone who doesn't. And on the right side of this slide, we have found multiple startling statistics. So the first one is about 1 in 54 children has been identified with autism spectrum disorder, or ASD. And according to estimates from CDC's Autism and Developmental Disabilities Monitoring, so that's where many of these statistics are from, ASD is more than 4 times more common among boys than among girls. ASD is reported to occur in all racial, ethnic, and socioeconomic groups. An estimated of 5,437,988 people, or 2.21%, of adults in the United States have ASD. And on average, autism costs an estimated of $60,000 a year through childhood, with the bulk of the costs in special services and lost wages related to increased demands on one or both parents, so not being able to work full-time or taking time off work, and costs increase with the occurrence of intellectual disabilities. And drowning remains a leading cause of death for children with autism and accounts for approximately 90% of deaths associated with wandering or bolting by those age 14 and younger. On our next slide, Samuel will explain what autism is and why it is important.
So, just some background information. Autism was originally reported as a form of childhood schizophrenia that was thought to be caused by bad parenting choices. It was later described as a set of developmental disorders until it finally rested on a spectrum with ranging degrees of impairment. What is autism? Autism spectrum disorder is a developmental disorder that is characterized by problems in social communication and interaction, as well as repetitive or restrictive behaviors, interests, or activities. Why is it important? There are a wide variety of characteristics and symptoms that can occur in someone who has autism spectrum disorder. It is important to understand the defining characteristics and ways in which we can help the varying needs of those with ASD. This is important to understand so healthcare workers can properly diagnose ASD patients, and so people with ASD can lead healthy and holistic lives. By understanding ASD, we can better help people with ASD integrate into society without being misunderstood or looked down upon. And now Kelsey is going to touch on some research.
So when researching about ASD, we found research articles that emphasized certain counseling theories and memory strategies, which Lachelle will also touch on later in our presentation. But this research looked at how these specific strategies can be helpful for people with ASD. For example, on the top left paragraph, we summarized that typically memory strategies are important for the development of cognitive abilities of children. But for children with ASD, memory strategies typically have shown less benefits. But this particular study focused on controlled awareness and attribution training. And after gathering data, this study found that memory strategies can actually benefit children with ASD. This information would be important and vital if you are in childcare or a teacher. Beneath that paragraph, we found another research article which focuses on cognitive behavioral therapy in youth with ASD and anxiety. The researchers found that treating ASD patients with antidepressants can actually be less effective than those who receive CBT therapy. I tend to personally be more holistic in solving or aiding medical diagnosis, so I found this research to be uplifting and like I could actually make a difference in someone's life by choosing this program and with people with varying abilities by practicing CBT. On the right-hand side, we also found many articles highlighting the parental hardships of caring for a person with ASD. Not only are medical costs extremely high, but many caretakers face anxiety and depression as they become caretakers often for the rest of their lives. In the top right paragraph, a research article we found says mothers particularly are at a higher risk for depression. And for all of us, COVID has impacted our lives in one way or another, but this is especially true for folks with ASD and varying abilities. Isolation and the difficulty of adapting to a new normal, which we all are probably sick of hearing, can cause even more characteristics of this disorder to appear. We felt this research was important to note as we go about our lives to be extra supportive and caring for people in our communities or churches who have varying abilities. In the next slide, Lachelle will talk about how autism is addressed by mental health counselors.
Unfortunately, there is no cure for individuals with autism disorder. Multiple types of therapy are used to cope with symptoms and to teach skills to individuals with autism. The therapy that I most often hear about is applied behavioral analysis, also known as ABA. This encourages positive behaviors and discourages negative behaviors. The progress is measured and tracked to see if there is progress. There are various ABA techniques that can be utilized. Cognitive behavioral therapy also benefits people with autism, as Kelsey just spoke about. Assistive technologies are electronics that aid in communication for individuals who are unable to communicate verbally. Speech therapy teaches individuals how to communicate either through speech, through gestures, or other forms of communication. Some people with autism are unable to speak. Social skills training teaches individuals how to interact with others. So this is different than speech therapy. A study conducted by Kathleen Eaps showed benefits in individuals that engaged in art therapy and group therapy. Occupational therapy teaches individuals how to complete basic living skills. This can be teaching someone how to do their laundry or do their dishes. In addition to these therapies, medical interventions are used to assist symptoms of autism. Doctors can prescribe medications to reduce symptoms. Also, dietary changes can improve behavior of children with autism. These therapies, along with the prescription that is given, are catered to the individual's needs. One person may need a lot more speech therapy than they do occupational therapy. Autism is a spectrum disorder, and everyone is different. Next, Samuel will be speaking about the relevance of autism in minority populations.
A big issue in regards to ASD and how it relates to minority populations is how accurately it gets reported in their communities. Autism and developmental disability monitoring reports have been regularly reporting more white children with ASD than either Black or Hispanic children. Studies in the past have shown that prejudice or stigma, language barriers, and inability to access healthcare because of citizenship status or insufficient funds might be having an effect on the lack of identification of ASD in these minority communities. This is a problem because it means that children are not being diagnosed or being misdiagnosed, are not getting the help and services that they might need in order to reach their full potential. Although this is still an issue, the gap between identification for white children and minority children is steadily decreasing, going from a high of 1.7 to 1.2 for Hispanic children and a high of 1.4 to 1.1 for Black children when compared with white children. Next, Lachelle is going to talk about some common misconceptions.
Almost everyone has heard that autism is caused by vaccines. The American Academy of Pediatrics has conducted numerous studies that show autism is not connected with vaccines. The initial study that stated this has been disproven multiple times. Another misconception is that people with autism are unable to feel emotions. This is a myth. People with autism can feel emotions. They just perceive and express emotions differently than people who are not on the spectrum. Along these lines is people with autism don't like to be touched. This is not true. Some people with autism do enjoy being touched and being given light massages. This is dependent on how the person responds to sensory stimuli. I have worked with a young man who is high needs, and when he walks with you, he likes to hold your hand, he likes to hold on to you. He very much enjoys touch. Another misconception is that all people with autism have a low IQ or not smart. First off, this isn't nice. And 44% of individuals with autism have an average or above average IQ. So this is identified as an IQ over 85. 31% of people with autism are considered intellectually disabled, which is defined as an IQ of 70 or less. 25% of people with autism are considered borderline intellectually disabled, which is identified as an IQ of 71 to 85. So once again, 44% of people with autism are average or above average in intelligence. Something else Kelsey touched on is insurance covers, is that autism is expensive. So a myth is that insurance covers therapies for autism. This is not necessarily true. Many insurance companies exclude coverage plans for autism. Thanks to advocates, 48 out of 50 states have passed some form of autism insurance coverage laws. So hopefully this will alleviate some of the financial barriers that families have. The next misconception is that autism is a mental illness. As Samuel stated, autism is a developmental disorder, but it's also a neurological disorder. It does have co-occurring disorders such as gastrointestinal problems and epilepsy. In addition to this, people with autism are twice as likely to have a co-occurring mental illness. This is likely where the myth comes from that autism is a mental illness. Another misconception that Samuel touched on is that autism is caused by poor parenting. In the 1950s, the term refrigerator mother was used to refer to mothers of children with autism. Some thought that mothers who lacked emotion or were not emotionally supportive to their children caused their children to have autism. There's no evidence that parenting style can cause autism. However, environmental factors such as parenting styles can contribute to the symptom severity in children with autism. Finally, another misconception is all people with autism are the same. This is not true. Autism is a spectrum disorder, therefore no two people with autism are the same. One person with autism may be able to live independently and socialize, while another cannot even care for themselves. So I worked with a mother and son. The mother supported them. She She would take care of her son. She would take him to all of his appointments. She was able to pay the bills. She did struggle with socializing, but that was the only barrier she really had. Whereas her son, who was 19, could not talk, could not care for himself. And the day he learned to bake a pizza supervised was very exciting. That was a huge step forward for him. Next, Samuel will be giving us a summary of what we've spoke about today.
In summary of some main points of our presentation that are important to keep in mind is that autism spectrum disorder affects more people than what we might originally anticipate. Another is that autism is addressed by mental health counselors through multiple different types of therapy. For example, applied behavioral analysis and cognitive behavioral therapy. Another major point is that there's still significant racial and ethnic disparities in recognition of ASD in spite of steps being taken. Another are that there are a lot of misconceptions as to how people develop ASD, and it's important to keep in mind that not all of those are true. Next, Kelsey and Lachelle will talk about some recommendations for further research.
So initially, when we started researching, we were trying to find information on people who were low functioning, so children who were low functioning. We found that most of the research was dedicated to high functioning individuals. We do feel that further research is needed for low functioning autistic children. This could possibly aid in better outcomes for these children. So that is definitely something we feel that needs to have further research. Another thing is what age groups or what group of people with ASD are therapies most helpful for? So is occupational therapy better for an older child than a younger child, or vice versa? This could aid in treatment for those with ASD. Finally, for me, is which minority groups are most affected by ASD? As Samuel touched on, ASD isn't well diagnosed in minority groups. So there needs to be more research on this to find out how prevalent it is in the minority groups, and see if it is just as prevalent in those groups as it is in majority.
Yeah, thank you, Lachelle. And then the last two are number 4. What are ways stress and depression can be lowered for caregivers in the long term? Again, we just talked about the huge financial and stressful parts of caregiving that people deal with that have a loved one with ASD. So I guess in the long term, how is that best cared for? And number 5, what will the long-term effects be of COVID-19 on people with ASD? Again, with quarantine and isolation, how does that affect people with ASD, and what other symptoms of the disability does it bring out?
And these are our references.